In this episode, we talk about social distancing. Get excited because this is Tiny Leaps, Big Changes. Welcome to another episode of Tiny Leaps, Big Changes, where I share simple strategies you can use to get more out of your life. My name is Greg Clunas, and in this episode, we're talking about a topic that is top of mind for many people across the world today. And quite frankly, it should be something that more of us are educated about, more of us fully understand, because it is our really only tool right now to stop and slow the spread of the coronavirus. So we are going to be discussing it in this episode. I know maybe you were listening to this show looking for sort of like a escape from the constant conversation around the coronavirus, but I do really think it's an important topic. So we are going to be discussing it in today's episode, and I encourage you to listen to it all the way through so that you fully understand everything about it, everything that you should know about it. You can get some additional resources to learn more about it, and we can all do our part to reduce the spread of this disease. So with that said, before we jump into the full episode, I do want to take a look at today's sponsor. This episode of the podcast is sponsored by Surfshark VPN. Surfshark is a VPN service that makes online privacy protection easy and attainable. Surfshark encrypts all internet traffic sent to and from your devices and ensures that your IP address remains hidden to make sure nobody can see what you do online. On top of that, they block ads, trackers, malware, and phishing attempts. And unlike other VPN services, you can use it on as many devices as you'd like simultaneously. Here's something you might not know about me. I'm a massive fan of the UK reality show Love Island. A few months back, I finished all 5 seasons of the UK version when I learned that there's also an Australian version, which sounds amazing. Unfortunately, it was only available on Hulu in Australia at the time. Now, if I had Surfshark VPN back then, it wouldn't have been an issue. All I'd have to do is log in, switch my location to Australia, and bam, instant access to all of the cool stuff they get to watch that just isn't available here in the US. You'll never have to worry about being region locked ever again. And the most exciting part about this is that it can help you save money when you're traveling. All these travel sites, right? They know where you are accessing it from and how likely you are to purchase a ticket at a certain price. People all over the world see different prices for the same flights. Crazy, right? With Surfshark VPN, just change your region and shop around for the lowest ticket price. But don't take my word for it. Try Surfshark VPN out for yourself. Head over to www.surfshark.deals/tinyleaps and use my promo code tinyleaps at checkout to get 83% off and an extra 1 month free. That's www.surfshark.deals/tinyleaps. Okay, so the first place to start with this, we're really looking at the topic of social distancing, right? So that has been the main guideline put out by the Center for Disease Control here in the United States, as well as the World Health Organization across the globe. And what I want us to really understand by the end of this episode is what social distancing is, what these sort of basic rules and guidelines are that we should all be following and keeping in mind, and how to approach our day-to-day lives with the understanding that this is an important piece of it, at least for the foreseeable future until we receive word otherwise, until this thing gets under control. So let's start here. What exactly is social distancing? Now, the actual definition of social distancing is, and I quote, "Social distancing is a set of non-pharmaceutical infection control actions intended to stop or slow down the spread of a contagious disease." So the idea here is very simple. We want to, if diseases are passed between people, right? So through physical contact, through coughs, sneezes, sort of passes through the water droplets that come out of those actions, through surfaces that we might touch or engage with. There are a number of ways where viruses can pass from one person to another. If that is the case, and we are all sort of engaging in our day-to-day lives. We're going to the supermarket. We're going to restaurants, going to work. We're all touching surfaces. We're all interacting with the world around us, interacting with people around us, shaking hands, giving hugs. And we don't think about these things because we can't see them. Right? It's not something that we can actually see the transfer happen. And so it doesn't pop into our minds that this might be happening. Now, in our regular lives, this is fine. The most you might get is a cold from somebody else. This becomes a problem, and a major one at that, when we are looking at something that, one, has no cure, two, has very little ways to sort of control it, and three, we simply just don't know enough about. And that is the case with the coronavirus right now. We don't know enough about it. We have no cure for it, no real way to mitigate its effects. And without those things in place, we're seeing a situation where if the number of cases spikes past a certain point, the systems that we currently have to manage it will fall apart. And what I mean by that is the number of people needing beds at the hospital, the number of people needing masks, the number of people needing help from the healthcare community will get to a point where there is just not enough to support them. And without any real way of reducing the effects or curing the illness, and really just sort of having to wait it out and hope that it doesn't end in a death, that unfortunately leaves a scenario where we just can't get people back out of those beds and out of the hospital as quickly as we would need to in order to bring new cases in. So that is the big issue that is being faced right now. And social distancing, which, as we just discussed, is a non-pharmaceutical approach to slow or stop the spread of contagious diseases, is one way to reduce the number of diseases without even fully understanding what the disease is, what the virus actually is, and what it will react to. Because if we are never in those situations where surfaces are being touched, maybe people aren't washing their hands properly, maybe somebody's sneezing and not covering their mouth correctly, if we're avoiding those situations altogether, then the overall number of cases will not only reduce from what it would have been, but it'll also slow in terms of the speed of growth, the exponential rate of growth. So this is ultimately what the goal of that social distancing is. And this isn't the first time that we in the US have done this. Back in 1918 for the influenza pandemic, this was also the recommendation to help slow the spread of that flu. So here's a quick quote on that from a USA Today article that I have linked in the description of this episode about the coronavirus pandemic and what you should be thinking about, some myths that they have busted around it. Recommend you click that link and read it. But here is one quick quote in relation to the 1918 influenza outbreak that we had to also do social distancing for. Quote, "Many cities undertook just these measures over 100 years ago to blunt the impact of the 1918 influenza pandemic. Those that acted swiftly and decisively were rewarded with fewer cases and a lower peak of cases, relieving the demand for medical care." End quote. So the idea here is very simple. We just need our job as the citizens, as the people that maybe we're not in charge. Maybe we don't have any say over treatment plans. Maybe we don't have any say over how to actually fix this problem. Our job, the thing that we can do, that we have control over, is choosing to distance ourselves from everyone else as much as physically possible. Because that will slow the spread of this thing, slow the number of cases down enough that one, more time is bought so that the experts, the people who are on top of this, can actually find a long-term solution. And number two, the hospitals and the healthcare professionals who are in charge of dealing with this can actually manage the influx of people coming in without that then causing a disruption to people who are suffering from other illnesses that also need help, as well as those resources, the beds, the number of people that can work on an individual getting sucked up by just a massive burst of cases. So that is why social distancing is important. That's what it is, and that's what you need to know going into this. And just to give three very solid reasons here as to if you're skeptical, if you are one of those people that still feel like, oh, you know what, this isn't really affecting me, it's not that big of a deal yet. Here's why this is important. Here's why you need to be paying attention to this, why you need to be engaging with this, even if you don't know anybody that has been infected, even if this hasn't touched your life yet, even if you feel like maybe the media hype is just a little blown out of proportion, as it sometimes is for many things. This is still important. This is still something you need to be engaging with. It is your duty as an individual in this country to engage in this, even if you don't fully believe that it's necessary yet. Here's why. Number one, we do what is called flatten the curve. Now, you've probably heard this term over and over again over the last few days. I've seen it all over the place on Twitter. The media has been talking about it. The idea here is very simple. The growth curve of this disease, of this virus, and how it has spread across the country, that is doing an exponential growth right now. So it's not just going up linear, 1, 2, 3, 4, 5 cases found, blah, 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 growing one by one. It's going from 1 to 7 to 45 to 3,000. Like, it's jumping very, very quickly. That rate of growth is too fast for hospitals and healthcare professionals to handle. We need to flatten that out so that they have the resources to handle the individual people that come in. They can get the help they need. They can get discharged, and then more people can come in. We need that to be flat in order for the systems to hold up. Your job to stay home and social distance, its purpose is to help flatten that curve. If we all engage in that, guess what? Very few new cases can be created. And that allows us to flatten that curve. That allows the exponential growth to go back to one that maybe it is still growing, but it is now linear. And that's ultimately the first goal. The second big thing that comes from social distancing, also from flattening the curve, is that it gives our healthcare professionals and the leadership that is in charge of dealing with this more time to react. If something goes from 0 to 1.5 million people in a week, that's really difficult to now solve, because not only is it a problem you don't know how to solve, but it also has affected enough people that it is likely to affect significantly more people. If every single person that has been infected is in contact with 7 other people, you can get a massive growth ridiculously fast, far too fast for anyone to be able to react. If we want a long-term solution for this problem, the people who are in charge of finding that solution need the time to actually find it. It's not something they can just come up with overnight. This wasn't something we were prepared for. And so social distancing is there and to flatten the curve so that those people have more time to react, more time to prepare all of the different treatments that we might need, more time to get the resources that we might need, and more time to find the long-term solution that ultimately allows us to win this battle over time. And then finally, for those of you who maybe don't feel like this is a big deal yet, the number 3 big reason for engaging with social distancing right now is that you need to protect yourself and your family. Think about it. If you are still going out, you are still just sort of living your life as normal, which I understand the urge to. If you are doing that, though, your chances of getting infected is very high. There are not enough tests in the United States right now. We don't actually have an accurate number on how many people actually have been exposed to this thing and have the actual disease, might be a carrier, but not showing symptoms yet. We don't have an accurate number. And so it's much safer to assume that everyone you are in contact with or could be in contact with might have it. If you do not live your life with that assumption, and you still go out, you are still engaging, you're still doing everything as normal, and someone just thinks they have a cold or just thinks they have a flu or just thinks that it's just a normal illness, but they happen to be carrying it and you get exposed, then you go back home. You are in contact with your family. You are in contact with your friends. You are in contact with everyone around you. All of those people are likely to be infected. And guess whose fault that will be? Yours. Now, I don't say that to place blame. I don't say that to make you feel bad. I say that to drive home the importance of why you need to be paying attention right now and actually making that conscious choice, even if you are healthy, to stay home. Now, I know some jobs don't make that easy. Sometimes, there are things in life that make that hard. That's why the recommendation is, when possible, you need to do as much as what is in your control to reduce the spread of this and to reduce your chances of getting infected and therefore infecting everyone around you. But there are limits. There are things you do not control. All you can do is what you control. So do that at the very minimum. That's all that's being asked of you. So here's some basic rules to follow that will help in this scenario that we find ourselves in. Number one, stay at home when possible. Stay at home as much as you can. Now, of course, you're going to have to go out for groceries. You're going to have to do certain things outside of the house. When those things need to happen, try as hard as you can to do it at a time that will avoid the majority of people. And when you are out, try as much as possible to keep a 6-foot minimum distance away from the other people around you. If you can avoid people when you are out and then also choose to stay home as much as you can, then you create a scenario where you significantly reduce the chances of you getting infected. Number two, if you are feeling ill in any way, if you have any of the symptoms, a fever, a cough, you may not have coronavirus. And I have a link to an article by The Guardian that has the full list of symptoms. I highly recommend you read that. Be educated. This is not a good time to not know what is going on. But if you have any of the symptoms, you may not actually have it. But be safe. Assume that maybe you do. And your job, if you do have to go out, is to wear a face mask. Now, if you do not have the symptoms, do not go out and stock up on face masks. Other people need them. We don't want to create a scenario where people who actually have the virus aren't able to get face masks. If you don't have any of the symptoms and you are engaging in social distancing, then don't go out and buy up all the face masks and stop everyone else from being able to get them. If you do have symptoms, wear a face mask when you are out and do the best you can to reduce spreading that potential of having the virus. And then number three, if these events have not already been canceled, which they should be, I believe that the government recently stopped all events with gatherings of over 50 people. I may be wrong on that, but if it hasn't already been canceled, do not go to that event that you've been planning to go to. It doesn't matter if they've decided, okay, we're going to cancel it or not. It truly does not matter. Your job, your responsibility is to decide whether or not you go. You can contact them. You can get a refund on your ticket. You can, a lot of companies are honoring those requests because this is something outside of our control. But there is a lot that you can do to make it so that you don't lose anything from this. But it doesn't matter how excited you are. Do not go to those events. Events of more than 50 people should already be canceled, but there's still plenty of events where 30 people are attending. Don't go. There's no reason for you to be there unless it's completely necessary. This is not the time to give in to that feeling of, oh, but I've been really looking forward to it. It doesn't matter. It doesn't matter if you've been looking forward to it. This is something we need to take seriously. We have two potential outcomes here. Either this turns into a situation like it did in Italy, where the entire country has to be locked down and doctors are forced to decide who lives and who dies based on their chances of survival, where people who are elderly and have had previous illnesses that maybe make them less likely to survive are not getting treated simply because the resources need to be left for the people who might survive. If you don't want to create that scenario, our job as the citizens in this country, in the United States, and citizens all over the world who are struggling with this, is to do the best we can. We can't control everything. We don't know what the government is going to do. We don't know what the CDC is going to do. We don't know what the doctors are going to do. But we can control our choices day to day. And the same way that I tell you on this show every single time, all big changes come from the tiny leaps you take every single day. The purpose of that is to say that the choices you make right now matter. And the two outcomes that we have are either it goes the way of Italy, or we're able to slow it, flatten the curve, and find a long-term solution. One of those two things are going to happen. We're the people who have control over that based on the choices we make. So don't be an idiot here. Don't be ignorant here. Choose to engage and understand this situation as much as you can. Now, with all of that said, I love you. Thank you so much for taking the time to tune in to today's episode. I know it's not as fun as some of the episodes that you've listened to in the past, but it is still important, and it does affect us on a day-to-day basis in our personal lives. Be sure to share this with anyone that you think isn't taking this as seriously as they could, or maybe just don't understand it as well as they should. Let them know this exists as a resource. I'd love to be a part of helping them understand what the situation looks like and what we need to be doing as a community. Thank you so much, and remember that all big changes come from the tiny leaps you take every day.